Dear students, welcome back. In the previous session, we have discussed about extrinsic finger flexors. Now, in this session, we are going to discuss about intrinsic finger musculature. I have already mentioned which muscles are called extrinsic muscles and which muscles are called intrinsic muscles. Intrinsic muscles will have attachment below the wrist joint, both their origin as well as the insertion. Those muscles comes under intrinsic muscles. So in this session we are going to discuss about the intrinsic finger musculature. Especially in this session we are going to discuss about the intersei muscles and lumbricals. Okay, so we are having two types of intersei muscles. One is dorsal intersei and olar or palmar intersei muscles, and lumbricals is the other group. The lumbricals is normally present on the palmar aspect, and this intersei are present both dorsally as well as palmar aspect. Okay, so in this session we are going to discuss about mainly the attachments of the muscles. If you understand the attachments of this muscle, then only we can understand the function of these muscles. So at different levels. So what is the function at MCP joint, and what are the functions at interphalangeal joints? If you understand these attachments, then you can easily differentiate the functions at various levels. Okay, yes. Now, first we are going to discuss about the dorsal intersei. So, the dorsal intersei are mainly four small muscles. Here you can see mainly four small muscles which are placed between the metacarpal bones, and these are numbered from lateral to medial side. This one is lateral and this one is medial. So this one is right hand. Okay, so and the numbering also starts from lateral to medial. So first, second, third and fourth. So how many muscles? Four small muscles which are placed between the metacarpal bones and are numbered from lateral to medial side. Yes. Now we will see these attachments one by one. So first we will see the origins of all these intersei muscles. The first dorsal intersei is originating from the shafts of first metacarpal as well as the second metacarpal. Okay. Yes. So the first dorsal intersei is originating from the shafts of the first metacarpal as well as the second metacarpal. And the second dorsal intersei is originating from the shafts of second and third metacarpal. So this is again second and third metacarpals. If you see this thing, so the first dorsal intersei is originating from the medial side of the metacarpal, first metacarpal, and lateral side of the second metacarpal. If you see the second intersei, which is originating from the medial side of the second metacarpal and lateral side of the third metacarpal. And again, if you can see this third dorsal intersei, which is originating from the shafts of third and fourth metacarpals. So same way, if you can see the sides also, so from the medial side of the third and lateral side of the fourth metacarpal. Okay, and if you see the last, that is fourth dorsal intersei, which are originating from the shafts of fourth and fifth metacarpals. Okay, so these are the origins of the dorsal intersei muscles. Okay, and the insertion, which is very, very important, you have to understand. Okay, each muscle is inserted, so that means each intersei muscle is inserted into the dorsal digital expansion, okay, of the corresponding digit and also to the base of the proximal phalanx. Okay, so if you can see the fibers, so it is having two fibers in the case of insertion, isn't it? So in this one is the proximally inserted fibers, and this one is the distally inserted fibers. So the proximally inserted fibers are mainly inserted into the base of the proximal phalanx. You can see here, this is the base of the proximal phalanx of the digit, and it also, some of the fibers also inserted into the extensor hood. Actually, hood will start at this level. So some fibers of the proximal fibers of this intersei is getting inserted here, and the distal fibers of the tendon of the same intersei is going to insert into the dorsal digital expansion. So in that expansion, normally we'll have lateral bands as well as central tendon. So these fibers are going to insert into lateral band and the central tendon. So this is very, very important, you have to understand here. Okay, yes. So now, so each muscle is going to inserted into dorsal digital expansion of the digit, mainly at the distal attachment, and into the base of the proximal phalanx, that is the proximal attachment of the intersei muscles. Okay, the digits into which individuals muscles are inserted as follows. Here, if you can see this thing, the first one is going to inserted on the lateral side of the index finger. Got it? Yes, lateral side of the index finger. And the second one is going to insert on the lateral side of the middle finger, and the third one is going to insert on the medial side of the same middle finger. Okay, so that means the middle finger is getting attached with two intersei muscles. Keep it in mind. Okay, and then the fourth one is going to attach on the medial side of the fourth digit. Okay, so here, if you see all these origin and insertions, the action of these dorsal intersei are abductors of the digits. That means away from the line of the fingers. So when these muscles are contracted, these fingers will move away from the midline like this. So if you observe, the little finger does not have a dorsal intersei, because this little finger itself will have an individual muscle that is called abductor digiti minimi, which helps in the abduction of the little finger. Got it? Yes. So this is about the attachment of this dorsal intersei. And coming to the attachment of this volar aspect of the intersei or palmar intersei, Normally this palmar interossei is also 4 in number. Sometimes it appears only 3. The first interosseous muscle, which is also giving numbering from lateral to medial. So the first interossei, that is near the thumb. Okay, so normally it is rudimentary. If it is present, it is normally acts at the thumb as an adductor. Okay, along with adductor pollicis or flexor pollicis brevis muscles. Okay, yes. So, but we are going to consider the interossei, the palmar interossei muscles as 4 in number. So these 4 muscles are also placed between the shafts of the metacarpal bones. Okay, so now we will see the origin of the first palmar interossei muscle. So the first palmar interossei muscle is originating from the medial side of the base of the first metacarpal bone. Medial side of the base of the first metacarpal bone. And the second one is originating from the medial half of the palmar aspect of the shaft of the second metacarpal bone. Okay, so this is also right hand. Okay, so on the palmar aspect from the medial half of the shaft of the second metacarpal bone. And the third palmar interossei muscle, which is originating from the fourth metacarpal, which is very, very important. So the palmar interossei doesn't have any attachment to the middle finger. Got it, ma? Yes. Yes. So, and the fourth palmar interossei is originating from the lateral part of the palmar aspect of the shaft of the fifth metacarpal. Got it. So the first and second is having origin on the medial side of the metacarpals, whereas third and fourth interossei is originating from fourth and fifth metacarpals. Okay, so these are the origins. If you see the insertion, each muscle is inserted into again dorsal digital expansion. So these muscles are also inserted into dorsal digital expansion. So these are also having the same attachment. So it is going to attach the base of the proximal phalanx of the same digit. Okay? Yes. Now we will see the insertion here. The first muscle, that is medial side of the thumb, is getting inserted into the medial side of the proximal phalanx, whereas the second muscle is going to inserted on the medial side of the index finger, and third muscle is going to insert on the lateral aspect. So very, very important, lateral aspect of the fourth finger, and fourth muscle is also inserted at the lateral side of the fifth digit. Okay, so again here you can see the middle finger doesn't receive the insertion of any palmar interossei muscles. It doesn't receive any palmar interossei muscle insertion. Okay, so the main action of all these palmar interossei will help in adduction of the digits to which they are attached towards the middle finger. All this will have the adduction towards the middle finger. You can easily say because of this attachment, so the contraction on the medial muscles which are present on the medial aspect. So when contraction of these muscles leads to the movement of this metacarpals towards the medial aspect. The same way on the lateral aspect also. So all these intersei muscles are supplied by the deep branch of the ulnar nerve. So this is about the attachments of the intersei muscles. Now coming to the lumbricals. So this is right side lumbricals. So now we will see the origin of this lumbricals. So these are also 4 small muscles that take origin from the tendons of flexor digitorum profundus. So the flexor digitorum profundus is the deep forearm muscle. So which splits into 4 tendons for medial forefingers. So from these 4 tendons, these lumbricals are originating here. Okay, so they are also numbered from lateral to medial side. So this one is lateral and this one is medial. So first, second, third and fourth lumbricals. So these are all the tendons. Flexor digitorum profundus tendon. Yes. So from these tendons, these muscles are originating. Okay. So origin. So the first lumbrical arises from the radial side of the tendon of the index finger. So it is originating from the radial side of the tendon of the index finger, that is lateral side. And the second one is originating again from the radial side of the tendon for the middle finger. So middle finger, the second lumbrical is originating from the lateral side of the middle finger. If you see the third lumbrical, so this third lumbrical is having origin from 2 tendons. Okay, so from the medial side of the middle finger as well as, so this one is the medial side of the middle finger and also the lateral side of the forearm, that is ring fingertip. Okay, these two unite to form the third lumbrical, and the fourth lumbrical is also having origin from this continuous sides of the tendons of ring finger and the little finger. So again for the fourth lumbrical, it is originating from the medial side of the ring finger and lateral side of the little finger forms the fourth lumbrical. Okay, and if you see the insertion, the tendons of first, second, third and fourth lumbricals passes backwards on the radial side of the second, third, fourth and fifth. So this is the palmar aspect, so it goes backwards. Okay, so backwards on the radial side of the second, third and so this is the first finger, isn't it? So this is the second finger, third finger, fourth finger and fifth finger here. So on the radial side of the second finger, third, fourth and fifth fingers. So these tendons pass backwards, okay, on the radial side of these 3 fingers at the level of metacarpophalangeal joints. Okay, and these finally inserted into the dorsal digital expansions of the corresponding digits. That means all lumbricals are going to insert on the radial aspect of the digital expansion. Okay, so these are all the attachments of the lumbricals. Okay, and if you see the action of this lumbrical muscles helps in the flexion at the metacarpophalangeal joints and helps in the extension of the interphalangeal joints of the digit into which they are inserted. Okay, so how it happens now we will see in the next session. Thank you.